Transforming policy, transforming lives. Since our founding, Asian and Pacific Islander American Health Forum has remained a steadfast advocate for the health of Asian Americans, Native Hawaiians, and Pacific Islander communities. As the Health Forum celebrates 35 years advancing health equity, we continue to push for policies that address language access, data disaggregation, coverage to care, and that stand against attacks on immigrant communities.
Today, the Forum is a well-respected organization both in Washington and in our communities representing Asian and Pacific Islander health needs. It has advocated for and supported the federal guidelines for cultural competency, assisting in the codification of these guidelines, stressed the need for appropriate language skills for improved health outcome, and assisted with the development of culturally sensitive educational materials. It fought for disaggregation of the data based on race, ethnicity, nativity, and socioeconomic status to unmask the needs of the model minority and describe the bimodal distribution of health and wealth in the Asian community. It has supported research on these disparities nationally and locally. The Forum is needed more than ever today, as the country addresses racial and health disparities facing minority populations. The API community must not be forgotten, and the Asian American and Pacific Islander Forum must continue to be a part of that dialogue so that the needs of our communities are appropriately articulated and recognized, and receive those services needed so that we can eliminate health disparities and achieve health equity for all Americans.
The Health Forum's impact to policy has not only been affected at the national level, but also in communities and at the state level. We allow communities to mobilize and advocate for themselves, and this has become a wonderful strength of the Health Forum.
Welcome and hello. 환영합니다. 안녕하세요. Thank you to our partners and supporters, all that are joining us tonight for the Asian and Pacific Islander American Health Forum's 2021 Health Equity Awards. I'm Juliet K. Choi, President and CEO of the Health Forum. On behalf of the whole of the Health Forum's family, I welcome and thank you for being here and celebrating with us tonight. For 35 years, the Health Forum has mobilized the Asian American, Native Hawaiian, and Pacific Islander communities to work towards ending health disparities and achieving health equity. This year's theme, Transforming Policy, Transforming Lives, is particularly fitting as we celebrate this milestone. The Health Forum works both on the ground with our family of community partners and in the nation's capital, advocating for our communities, lifting up the vibrancy, diversity of our community voice to all three branches of government, the administration and the executive branch, Congress, and as needed to the U.S. Supreme Court. I also want to take a moment to honor and celebrate the dynamic legacy of my predecessors at the Health Forum, an amazing legacy of female leadership who've led the Health Forum over the last 35 years. Tessie Guillermo, Dr. Ho Tran, and Kathy Ko Chen, along with our expansive network of board and staff, current and alumni. This past year has been a watershed moment, an evolving chapter in modern history for our communities and our country, marked by the devastating impact of COVID-19, a profound year and journey of racial reckoning, centering Black lives, denouncing xenophobia, and countering anti-Asian hate, and the desire and need to stand together in allyship, journeying together, neighbor to neighbor, community to community, family to family. I want to take a moment together with you to reflect upon and honor the lives lost due to the devastating global pandemic. In spite of the unequal consequences of COVID-19 and the outcomes upon our community, there have been incredible moments of hope, resiliency, optimism, and allyship, bringing a sense of unity and again hope and optimism looking forward. I am deeply appreciative of the work, time, dedication of our partners, our staff, and supporters who have contributed to quickly mobilizing and addressing the need for visibility and voice for the Asian American, Native Hawaiian, and Pacific Islander community, our health, and our families' lives. Over the past year, as you may know, we have worked in coalition with our steadfast allies and partners, including the Kellogg Foundation's Racial Equity Anchor Partners and our sister and brother organizations within the National Council of Asian Pacific Americans and our growing network of advocates. We've also been joined by new friends who have extended and gifted their voices, their dedication, and platforms to uplift not just our struggles, but really the spirit of the resiliency of our community. Transformation doesn't happen alone. It doesn't happen overnight, but together we can work together to transform and come together for a better future. On behalf of all of us at the Health Forum, I want to sincerely thank you for your friendship, engagement, and partnership as we continue on this path of health equity for all. Now I'm pleased to introduce the Health Forum's board chair, Dr. Diane Paloma. In addition to serving as the board chair of the Health Forum, Diane embodies a spirit of leadership, a living legacy of community, resiliency, and grace.
O naunai ka halame kale hua he halele hua no yana ka no e o ka uno ia no inei e li ane ho'i o ka hiki mai a hiki mai no o ko a hiki pu no me ke aloha. Aloha e, aloha e, aloha e.
Again, thank you all so much for not only just joining us today, but also on this steadfast journey, the path towards health equity for all. We couldn't have made it here 35 years strong without your support. And we know, and we hope to continue to have you by our side as we journey to transform policy and transform lives. Now, Dr. Diane Paloma will introduce tonight's honorees. Please enjoy this evening's ceremony.
Our honorees have stepped up to this challenge and become beacons of light in a sea of darkness. They are our health equity champions. For our Policymaker Award, we thank Senator Mazie Hirono and Congresswoman Grace Meng for their fierce advocacy in Congress as they introduced and passed legislation to combat anti-Asian hate, support data disaggregation and expanding language access, and the restoration of Medicaid for our Micronesian brothers and sisters. For our Community Award, we thank Washington Post journalist Dan Diamond for his consistent reporting of the health inequities and wins for our community. In particular, Dan highlighted the Micronesian community's awareness of their impact to COVID-19 on Pacific Islanders, and then later to hope from the restoration of Medicaid to COFA individuals after 25 long years of waiting. For our organization award, we thank the National Asian American Native Hawaiian Pacific Islander Health Response Partnership, a growing constellation of 24 local and national organizations that the Health Forum has mobilized to develop and serve as a resource to address the disparate effects of COVID-19 in our communities. Congratulations and thank you to all the honorees for all the work that you have accomplished and all the work to come. As we begin the program, I want to convey my deepest gratitude to our champions, our colleague organizations, our funders and sponsors, our Health Forum staff, and my board colleagues. I would like to say thank you to the performers and speakers at tonight's event. Most of all, I'd like to thank you all for attending tonight's event and for your continued support of the Health Forum. Please enjoy this evening's event. Aloha.
Good evening. On behalf of the Biden-Harris administration, thank you to the Asian and Pacific Islander American Health Forum for 35 years of relentless and pioneering pursuit of health security and prosperity for all in America. And thank you for your incredible work combating the devastating consequences of COVID-19 and anti-Asian violence and xenophobia over the last 15 months. Hearty congratulations as well to your 2021 Health Equity Champion honorees, with a special shout out, if I may, to my buddies, Senator Mazie Hirono and Representative Grace Meng. Without you, the COVID-19 Hate Crimes Act of 2021 would not be the law of the land. For 15 months, Asian Americans have had to face two plagues: the COVID-19 pandemic and unhinged, racist, xenophobic violence. And just as we are determined to beat COVID-19, we are determined to beat anti-Asian violence and xenophobia in all its forms. President Biden left no doubt when he said, "We stand together against hate and racism, the ugly poison that has long haunted and plagued our nation." The president has put the weight of his administration behind these words. He established the COVID-19 Health Equity Task Force upon becoming president. He issued a presidential memorandum condemning and combating racism, xenophobia, and intolerance against Asian Americans and Pacific Islanders in the United States. And in what became a resounding bipartisan effort, he signed the COVID-19 Hate Crimes Act into law on May 20th. This new law cannot undo the injustice suffered by our sisters and brothers in the AAPI community, but it does strengthen our fight to defeat it. Count on us at the Department of Health and Human Services to be on the front lines of this fight for justice and for real, equitable health care. The President's COVID-19 Health Equity Task Force has its home at HHS. As part of the task force, we've established a subcommittee on structural drivers of health inequity and xenophobia, which will recommend measures to mitigate anti-Asian xenophobia and bias and to advance health equity for AAPI communities disproportionately infected by COVID-19. And HHS is allocating more than $49 million from the American Rescue Plan for community-based, culturally specific services and programs for survivors of domestic violence and sexual assault. Stay tuned. I'll have more good news to convey from HHS in the days to come. But let's not forget that good news doesn't usually come without a lot of hard work. It takes champions, like your honorees, like you who have built and stood by the Asian and Pacific Islander American Health Forum for the past 35 years. Thank you for remembering to honor your health equity champions for 2021. And congratulations to all of you for fighting for justice and for meaningful access to quality care for our families. Happy 35th.
Hello and happy Asian Pacific American Heritage Month. I'm so happy to be here with the Asian and Pacific Islander American Health Forum for your annual Health Equity Awards as you celebrate 35 years of advancing health equity. And I'm even more thrilled that you will be honoring two truly incredible leaders, my good friends, Senator Mazie Hirono and Congresswoman Grace Meng. They accomplished the historic feat of getting the COVID-19 Hate Crimes Act passed in the Senate and the House with overwhelming bipartisan support. But what was even more amazing was to be in the White House last week when President Biden signed this bill into law. So congratulations again to Senator Hirono and Congressmember Meng for working to enact this critical legislation to stop Asian hate. I also want to commend these two for the work they've done to address health disparities and advance health equity, especially throughout the coronavirus pandemic. We know that long before the coronavirus hit, AAPIs have had a harder time accessing care due to language, cultural, and geographic barriers. On top of this, the disparities that AAPIs have faced throughout the pandemic have gone largely unreported due to a lack of disaggregated data that's often masked the challenges that certain AAPI subgroups are facing. But from the limited data we do have, we know that the coronavirus crisis has had a devastating impact on our communities. In just the first year of the pandemic, there was a 35% increase in the mortality rate of Asian Americans compared to the average over the past 5 years. On top of this, Native Hawaiians and Pacific Islanders are continuing to experience the highest COVID-19 infection and mortality rates in several states, including my own state of California. And despite pressure from AAPI leaders, 31 states still do not release data on COVID-19 deaths on this population, which means that these communities are missing out on vital resources. That's why it's crucial that AAPIs are fully included in our COVID-19 response, which is something that we in the Congressional Asian Pacific American Caucus have been laser focused on over the past year. Last year, thanks to the leadership of Senator Hirono, CAPAC helped to expand Medicaid eligibility to COFA communities. And I'm proud that the American Rescue Plan that the House passed earlier this year provides $27 billion in funding to directly address minority health disparities. But I know there is more we can be doing. That's why I'm so grateful for your ongoing work to advance health equity. Before I close, I also want to congratulate Dan Diamond from the Washington Post on winning this year's Health Equity Champion Community Award, as well as the National AA NHPI Health Response Partnership for winning this year's Health Equity Champion Organization Award. Congratulations again to all of today's awardees, and enjoy the rest of your evening.
Good evening, everyone. My name is Ruben Wan, and I'm a guitarist and songwriter based in Los Angeles, California. I'm of Chinese descent, but I was born and raised in a small Latin American country called Panama. Today, I have the honor and pleasure of performing a couple of my original songs, and special thanks to the Asian and Pacific Islander American Health Forum for inviting me to celebrate this special night with everybody. Without further ado, here's the first song. It's called Rose.
We need to uphold our commitment to the Compact Nations.
APIAHF honors Senator Mazie Hirono and Congresswoman Grace Meng as our health equity policymaker champions. From their monumental efforts, introducing and passing anti-Asian hate legislation,
An attack on one group in our country is truly an attack on all of us.
to supporting disaggregated data and improved research,
Our community is bleeding. We are in pain, and for the last year, we've been screaming out for help.
to ensuring better language access and healthcare for our communities during this pandemic. Their work as advocates for Asian Americans, Native Hawaiians, and Pacific Islanders brings us closer to achieving true health equity during a time when our communities need it most.
We need data and in languages that the AAPI community can understand.
APIAHF is proud to recognize Senator Mazie Hirono and Congresswoman Grace Meng as our 2021 Health Equity Policymaker champions.
Thank you to the Asian and Pacific Islander American Health Forum and Juliet. I am honored to share the Policymaker Award with my colleague, Representative Grace Meng. COVID-19 has harmed our Asian American, Native Hawaiian, and Pacific Islander communities in unimaginable ways, but it has also brought us together. Since last May, we have restored Medicaid for COFA communities and made the COVID-19 Hate Crimes Act law. Working to restore Medicaid access for COFA citizens has been one of my top priorities since arriving in the Senate in 2013. 25,000 COFA citizens live in Hawaii. Like members of the COFA community across the country, they experience devastating and disproportionate levels of COVID-19 illness and death. In December, I led my colleagues in working to restore this coverage, helping tens of thousands of COFA citizens access Medicaid. While this is a significant step, our work is not done. We must address other challenges the COFA community faces. The pandemic has also revealed anti-Asian hate and discrimination across our country. More than 6,600 incidents were reported across all 50 states and the District of Columbia over the last year. The COVID-19 Hate Crimes Act showed that Congress can come together to send a powerful message of solidarity to the NHPI community. But change requires more than just legislating. It requires communities coming together. That's why I know work with our national partners like APIAHF will continue to be critical as we build a better future for our communities and for all Americans. Thank you.
Hi, I'm Congresswoman Grace Meng from Queens, New York. It's such an honor to jointly receive the Asian and Pacific Islander American Health Forum's Health Equity Award with my dear friend and colleague, Senator Mazie Hirono. Thank you, Juliet, and everyone at APIAHF for this honor. The Asian American, Native Hawaiian, and Pacific Islander community has been devastated by COVID-19 in unthinkable ways. But we have also locked arms within and across communities to tackle this pandemic and anti-Asian hate and violence. This week, President Biden signed our COVID-19 Hate Crimes Act into law, which will pave the way for better data collection of hate crimes committed against our community. I look forward to continuing to fight for our community to make sure we're visible and that our needs are addressed. This effort is made possible through collaboration with national partners like APIAHF and so many other community-based organizations to bring attention to the most urgent issues for our community. This is only the beginning. As the fastest growing demographic in the U.S., we are no longer viewed as silent and invisible. We are here, proud, and will continue to fight for equitable access to a better life for all Americans. Thank you so much for this.
Congratulations to the Health Forum and Juliet on 35 years of advancing health equity. COVID-19 has been difficult for underrepresented and underserved communities. Through it all, however, the Health Forum has stood strong for more inclusion and representation of communities of color. I look forward to seeing the exceptional work that the Forum will continue to accomplish.
Congratulations to the Health Forum and Juliet on 35 years of advancing health equity. I look forward to working with you to advocate for the health of underrepresented communities for many more years to come.
Congratulations to the Health Forum and Juliet on 35 years of advancing health equity. COVID-19 has been a difficult time for underrepresented communities, and during this period, the Health Forum has continued to be a leader in advocating for greater representation and inclusion of our diverse Asian American, Native Hawaiian, and Pacific Islander communities. I look forward to seeing the exceptional work that you'll continue to accomplish. Congratulations again.
Tonight, we honor journalist Dan Diamond and his reporting highlighting the stories of compacts of free association communities who have resettled in places like Iowa and Arkansas, their fight for healthcare, and living through the pandemic. His storytelling highlighted a 25-year struggle to correct legislative error that stripped Medicaid from the COFA community. APIAHF is proud to honor journalist Dan Diamond with the 2021 Health Equity Champion Community Award.
Hi, it's Dan Diamond. I'm grateful for this honor, and I'm proud to accept it, but I feel truly torn. First, the gratitude. Thank you to the Asian and Pacific Islander American Health Forum, from Kathy Cochin and Ben Vanzo first walking me through COFA 2 years ago as we sat outside the US Capitol, to Juliet Choi, responding to question after question through the pandemic. I relied on your expertise and insights into your years of advocacy to do this reporting. And then the voices who made these stories real to people in Washington, D.C. who had not heard of COFA before, from Marshallese like Irene Mound and Maitha Jolay, who opened up to me, an outsider, about the challenges facing their community, and health workers like Susie Stroud and Heather Rickardson, who took me inside their efforts in Dubuque, Iowa, to care for the Marshallese. I can't say how grateful I am. But to why I am torn, in the time it took to do my reporting across 2020, thousands of Pacific Islanders in the United States got sick from COVID. Too many died. And I can't help but think, if I'd only worked harder and done these stories faster. And to me, health equity means ensuring that everyone has equal opportunity to have access to healthcare. We're clearly not there yet. Restoration of coverage for COFA citizens is only a small step toward making our world a more fair place. I'm privileged to be a reporter at a major news organization. You have my word that I will keep trying to help shine a light on our nation's problems. And regardless, I hope you'll all hold me accountable and make sure that I keep using my platform in ways that advance health equity. In the meantime, thank you again for this great honor.
Hello, my name is Dylan Adler. I'm really happy to be here. I'm gonna do some musical comedy. I'm gonna start off with a song about a rumor that I heard online. I heard that this upcoming Christmas, Michael Bublé and Lin-Manuel Miranda, the writer of Hamilton, may do a Christmas duet together, which is like really cool, but also kind of a weird combination of people. I was trying to imagine, like, what would that Christmas duet sound like? I feel like Michael Bublé, he'd go like this, like, what a beautiful sight, what happened tonight, walking in a winter wonderland. In the meadow we could build a snowman, then put the diesel circus clown. Well, let's take a mirror to say no, man. Hey, yo, are you ready for the revolution? I was just ghosted by a white boy who owns a samurai sword. I am not well. Anyway, that was unrelated to the last joke. Anyway, this last song that I'm gonna do, Something that I really, really miss is seeing live performances during this time. And at the college that I went to, it was a really artsy college, so I would actually see a lot of student-written musicals. And I saw this one student-written musical that was about football. And I feel like the writer of the musical, much like myself, didn't know much about football. So I'm going to try to replicate a number from the football musical. I am playing the star quarterback. Here we go. Come on, boys. Let's play some ball, shall we? When I'm on the field, I feel strong. Hike, hike, touchdown. I rush past the line of scrimmage. I hear the fans applaud, but no one seems to know what it's like in my cleats. Whoa, did I just concuss? Not again. Life is a game, that game is football. Make a play, catch the ball, paint your face, spank a butt. Life is a game, that game is football. Oh no! Fumble. My God, fumble. Go deep. Yes, that is, so that is the end of my musical comedy portion. And I just kind of wanted to end on sharing something I wanted to say. So during the beginning of quarantine, during kind of the height of Trump's xenophobia towards Asian Americans because of COVID, I was attacked in New York, and I know a lot of friends who were also attacked and parents of friends who were attacked. And I think this whole time has been extremely scary and frightening for me and so many other Asians. I was afraid for my family, I was afraid for myself. But one thing that really gave me a lot of strength and inspired me was seeing so many Asians organize and feel this kind of sense of heightened community in the Asian American community and solidarity, and Asians kind of, you know, reaching out and fighting for our community and fighting for our elders. It really inspired me. You know, fighting for things like teaching the history of anti-Asian discrimination in the US, and just building spaces where Asians can share their pain, vulnerability, and anger and strength was something that really moved me and inspires me, and I really want to see more of that sense of Asian community. And yeah, that's all I wanted to say. Thank you so much for having me.
Since its founding, the National Asian American and Native Hawaiian Pacific Islander Health Response Partnership has been committed to offering culturally and linguistically accessible, on-the-ground public health resources for AA and NHPI communities across the nation. This unique constellation of over 24 grassroots and national organizations demonstrates the power of combining our many perspectives into a collective partnership to overcome the challenges our communities face. This proved to be especially critical during this time of COVID-19, where AA and NHPI communities were especially vulnerable. The partnership mobilized to develop and serve as a resource to address the disparate effects of COVID-19 in our diverse communities, providing accessible educational resources, supporting vaccination efforts, and empowering the work of local community health advocates and organizations. This massive effort included outreach throughout rural and metropolitan areas in almost all 50 states and throughout the Pacific, and ultimately included over 150 community partners, providing a strong foundation for future readiness and proving the power of a collective community voice. Tonight, APIAHF is proud to honor the National Asian American and Native Hawaiian Pacific Islander Health Response Partnership with the 2021 Health Equity Organization Champion Award.
Thank you. From the NYU Center for the Study of Asian American Health.
Malapito.
Fafatai Lava.
Thank you.
I'm Nancy Hoff of the Philippine Nurses Association of America Foundation. PNAA and PNAA Foundation are honored to accept this award. We thank you very much.
Hi, my name is Toy Nguyen. I'm the Chief Executive Officer of CMAC here based in Philadelphia, Pennsylvania. On behalf of our staff, communities that we serve, and the board, I humbly and gratefully accept this 2021 Health Equity Champion Award.
On behalf of the Asian Pacific Partners for Empowerment, Advocacy, and Leadership, APIAHF, I'd like to thank the Asian Pacific Island American Health Forum for this incredible Health Equity Award.
On behalf of our team from OCAPCO, we would like to thank the Asian and Pacific Islander American Health Forum for nominating us for the 2021 Health Equity Champion Organization Award and recognizing our community efforts.
Thank you for this great recognition. It has been a pleasure for APAPA to collaborate with APIAHF in fighting the COVID-19 pandemic.
On behalf of the National Council of Asian Pacific Americans, it is my pleasure to accept this award tonight.
And that last song is called Coffee or Tea. I hope you liked both performances. And last but not least, congratulations to all of tonight's awardees for their hard work in advancing health equity. I hope I see everybody soon again. Take care and enjoy the rest of your evening. Bye-bye.
Thank you for joining us for our 2021 Health Equity Awards. As we conclude this evening's event, I'd like to thank and acknowledge tonight's awardees: Senator Mazie Hirono, Congresswoman Grace Meng, Diane, and the National Asian American Native Hawaiian Pacific Islander Health Response Partnership, a network of over 24 organizations, for the tremendous work they've done to advocate for and give voice to our AA and NHPI communities. I want to personally and sincerely thank and acknowledge our speakers this evening: U.S. Department Health and Human Services Secretary Javier Braceta, Congressional APA Caucus Chair Congresswoman Judy Chu, CAPAC Executive Director Crystal Kai, Leon Rodriguez, and our amazing performing artists this evening, Ruben Wan and Dylan Adler. Lastly, I want to thank our Health Forums board, our staff, our network of community partners, consultants, and of course, our families and friends for continuing to keep our organization strong. I feel so privileged working with you to advance the Health Forum's mission and look forward to continuing our legacy beyond 35 years. 감사합니다. Thank you, good health, and good night.